Hello everybody. From now we will start lecture series on hematology. Along with that, we will also start lecture series on other subjects like pharmacology and microbiology. But first we will start or we will take first step from the lecture series on hematology. So in the first, I have prepared a section on the hematology and I'll upload it on the YouTube. So you can easily see what will be the next topic regarding the hematology. So today we will discuss basic introductions of the hematology. Why do we study blood? So in the hematology, we basically discuss three most important things. First, the most important component, hema means blood. So we have to study blood in depth for understanding how much important is it for our body. Second is we will discuss blood disorders. In our blood, you will see three basic components. First is the red blood cell, second is the white blood cell, and third is the platelets. So these three cells are the components very much important in the blood, and we will discuss all the disorders related to these blood cells. And we will also discuss the blood forming organs, where from where blood actually form in our body, like the bone marrow, like this one. And as we have discussed, or if I say, if I take the blood in the test tube, but important thing, that blood should be mixed with some anticoagulant that prevent formations of the clot in the blood. So if I take the anticoagulated blood in test tube, and after some time you will see formations of the three layers that will separate the different components of the blood. Like at the bottom you will see the settle down of the red blood cell, and in the middle you will see the buffy coat or the layer in which you will see white blood cells and the platelets, and at the top side you will see presence of the plasma, which is actually a fluid in our blood. So these are the three basic layers formed when I take the, or when we take the anticoagulated blood in the test tubes. Next, we will discuss different branches of the hematology. First is the clinical hematology, in which we will discuss simple basic tests related to the blood. So sometimes I think how amazing blood in our body, like we can check different scenarios, or the we actually check the status of the body by just knowing the different components of the blood. This is how important, that shows the importance of the blood in our body. So in the clinical hematology, we will do CBC, complete blood count, that shows all the numbers of the platelets, white blood cells, and the red blood cells. ESR, reticulocyte count, these are the immature red blood cells, and the peripheral smear, in which we will see the morphology of the blood cells. So these four things actually done in the clinical hematology, and the most common and the preferable test related to the blood is the CBC, complete blood count. Next is the hematopathology. We have to check the different components in the blood, so different cells in the blood that will show the different diseases, in which we have to do microscopic examinations, like microcytic hypochromic anemia will be seen in the iron deficiency and the thalassemia. So these are the different morphological changes happens in the different diseases, and we can know all these things by just looking into the cells of the blood. Next is the coagulation, or you can say hemostasis, that is the process which helps in the formations of the clot. In the coagulation, what type of test we do? In that case, we can do PT, prothrombin time, APTT, BT, bleeding time, CT, clotting time, and the D dimer. So these are the different tests for the coagulation profile. Next, immunohematology or blood transfusion medicine, in which we will go towards the blood grouping A, B, AB, O. So, this is common in blood and the recipient countries. If someone wants to donate blood, then we have to check whether this blood is compatible for the recipient or the patient or not. We have to first check the blood compatibility, blood grouping, then donor can transfuse the blood or donate the blood to the patient. And along with that, we will also do some screening for the HIV, syphilis, hepatitis B, C. So these are the important screening because, but the important thing, why do we do screening in that case? Because screening is quite important, because sometimes patient looks healthy, but it may have hepatitis B or C, which is not symptomatic. So, to prevent the transfusion of the hepatitis B, C from the donor to the patient, so we have to do some screening test to prevent the transfusion of these diseases to the patients. So, it is a good practice before transfusion for the screening. Next is the molecular hematology, in which we will go towards the DNA test, the PCR polymerase chain reaction, and the flow cytometry that is common in for the detections of the leukemia blood cancers like this. Oncohematology, in which we will discuss the blood cancers like leukemia, lymphoma, multiple myeloma, all the cancers related to the blood. So these are the different branches of the hematology. Next, we will move importance of the hematology. How much important is it in the medical field? So diagnosis. So we just look at the blood, or from the blood we can see the different scenario or the different conditions of the body. So that is the important thing. Like we can just looking at the blood, or by doing some test on the blood, we can know the anemia, leukemia, and bleeding disorders and the different infections which is happening in the body of the patients. So this is the important, how much important blood is it in our body. Like next is the monitoring, treatment monitoring, whether after the treatment whether the patient is going towards recovery or not. We can check also this by doing some tests related to the blood, like chemotherapy, iron therapy, and the anticoagulant therapy. So after doing different therapy, we can also do some test that shows whether the patient is going towards recovery or not. Blood transfusions, in that case we can go towards the cross match, blood grouping, and the screening. As we have discussed all these things, that is good before the transfusion. Otherwise, if the incompatible blood transfused to the patient, then it will create complications in the body of the patient, and even sometime death can happen in that case. In the research, you will see development of the different drugs for the treatment of the blood cancers, and the stem cell transplant and bone marrow transplant in that case. Public health. So we can check the anemia, thalassemia, and malaria, or that is important in the diagnosis of these anemia, thalassemia, and malaria by just doing a blood test. So after this lecture, you will be able to understand how much important blood in your body. So just doing test on the blood, you can know the different conditions of the body in our blood, and the different diagnosis. You can easily make diagnosis by doing some test related to level. So this is all about the introductions of the hematology. But if you still have any question, you may ask in the comment section. Thank you so much.